My name is Stefano Cotrufo and I'm a plastic surgeon in central London, Harley Street. Good evening, everybody. This is a communication from Dar es Salaam as we completed a 6-day surgical mission in Zanzibar. And I'm here with Dr. Lakani, who is the main sponsor of this mission. And it's an honor to be able to work with him. In Zanzibar, we spent 6 days operating. And the first day we screened about 25 patients. The reason why I came to Zanzibar is because unfortunately the incidence of burns here is extremely high and affects mainly young kids in the age between 1 and 10 years old. Up to now, unfortunately, 2024, there are no instruments in Zanzibar to treat burns. Thanks to Dr. Lakani, we donated the first dermatome, which we brought from UK. Target is to start training local doctors to assess better burns and treating them appropriately.
A few weeks after our last trip to Dar es Salaam and Zanzibar, I suddenly remembered that, two doctors with me were discussing that they had no dermatomes. I contacted one of the doctors and found out what it would cost and how we could help. So I contacted several sponsors. I raised enough funds to buy a dermatome and other instruments. It took us a long time to convince the Ministry of Health and the doctors and staff working in the ministry that we meant to do something for the children and adults suffering from burns.
You're mentioning that it was difficult to to get a response from the Ministry of Health. Obviously, we're talking about the Ministry of Health in Zanzibar.
Yes.
Not let's say not because they were not interested, but because, however, the situation is very complex and it doesn't involve just the minister himself, but a number of other members of the National Health Service. They go from all levels, from the local doctors to the hospital director.
Yeah.
And obviously their ability to facilitate the establishment of a new service of which so far they don't have any experience about, and yet they're aware that the incidence of burns in kids in particular is so high. They see very severe burns. For example, during the days where we were together in Zanzibar, I saw at least 8 new cases of burns over 20% of body surface area, and none of these kids was older than 5 years old. The consequences are disastrous, not just from a cosmetic point of view, but because the kids, well, the skin is not working, so they cannot hold the temperature, and they cannot manage the perspiration. And certainly these wounds are open wounds, and they are extremely painful. Not just when you change the dressing, but anytime they try to move, in particular if those injuries are involving the joints. We also operated on a case that had a very severe contraction and deformation of the feet because of a burn. So the plan is to straighten the big toe and then make smooth the surface and dorsal aspect of the foot so he can wear shoes normally. I think that the success of the mission was not simply to spend time for me operating in Zanzibar.
Exactly.
Operating 20 patients in about 1 week is something that certainly will help those lives. The real success, I think, is that I had the chance to find a team of doctors with basic training spanning from dermatologists, also cardiologists, and general surgeons. So 3 doctors decided to follow all the steps, and merging their skills, eventually they managed to repeat all steps of burn management. During those days, they had the chance to see what I was doing in one case and repeat it straight away on all the following cases. So basically, as the day passed by from day 1 to day 6, my presence in theater was not as a main operator, but slowly I was becoming a supervisor. The best feeling that I have at the end of this mission is that these doctors are willing to keep going. They have enough skill to assess burns, which, however, is the most difficult thing to do in terms of the grading, but also to use the dermatome that you donated and that, let's say, I trained them to use, which will speed up the healing.
Our charity will certainly try our best to encourage some young doctors to come to Zanzibar and spend some time with the doctors to ensure that they have learned and studied doing the right for the children and men or women with burns. I'm trying to contact a few doctors who have had a lot of experience on plastic surgery and ask them to spare some time to come to Zanzibar and take it up what Dr. Kotrofo has started.
Thank you. With regards to the participation as the sponsor to Zanzibar, how do you see things happening? Because what we did so far was to don't donate money to Zanzibar, but donate instruments and education. So the chart is based on bringing, investigating as we did in 2022, what the problems are, and then bring over the intelligence and the instruments to work.
Exactly. Well, with guidance from you, we will make sure that that we collect enough money from our supporters, and you advise us what sort of surgical instruments they need and what sort of doctors you feel should come to Zanzibar to help for a week or two or whatever they
Of
can.
course.
I'm sure that once these three doctors are well trained and they have gained some experience with your help and in future with the help of other plastic surgeons, that they will be able to train other doctors in other hospitals in Zanzibar.
That would be amazing. It would be amazing. And let's say that the enthusiasm in this moment in Zanzibar is so high.
Yes.
A new direction taken involving the director of the hospital and other members of the ministry, which is, the idea is to establish a plastic surgery unit
Yes.
at the hospital of Kiunde in North Zanzibar. And I think that if that would happen, the main advantage would be that it'd be much easier to facilitate the flow of plastic surgeons from all around the planet that are willing to help similar setting. So they experience in burns, in hand surgery, in facial plastic surgery. And certainly, let's say that incidence of other craniofacial malformations like cleft lip and palates are extremely high in those areas. So if there is a plastic surgery unit, that would be much easier to facilitate the mission from other doctors. And that's the reason why I accepted to chair the unit remotely, of course.
It will be fantastic, and you will certainly have all the support from us, and we will make absolutely certain that you receive whatever financial need you need.
Thank you so much. The aim of this video is certainly to introduce the work that we've done, also to facilitate donations with the help of doctors that are willing to pay their own flights, pay their own accommodations, obviously with the facilitation from the all friends of Dr. Lacani. The funds will be dedicated to the purchase of instruments and dressings and technology when needed, but nothing else.
There is certainly some objection from people working in medical foundations, hospitals, that it is the fault of the parents. For that reason, the children end up in hospitals for this sort of treatments. But my personal feeling is that, it's not the fault of the children. You can try to educate parents to ensure that the children do not suffer.
Absolutely, absolutely. Thank you for mentioning that,
Thank you.
because that was probably the most frustrating part of the whole journey. Seeing patients suffering, and particular kids, is certainly emotionally draining, but it's part of the job. But the worst thing that happened was to see the attitude of parents that were completely neglecting their responsibility. It was the kid that went close to the boiling water or close to the fire. We're talking about a toddler. We're talking about someone that is 1 year old. The two can be accounted responsible.
Of course.
They're victims of their parents. We have here a kid that is not even 1 year old that has burns for 30% of the body surface area, going between the third degree and second, superficial and deep. Communication should be very clear from the hospital, from the Ministry of Health, that these injuries are not kids' fault. Kids this age, up to 10 years old, cannot be responsible for their burns. And mothers instead need to be made aware from the moment they come to the hospital pregnant that they will be responsible for their kids. Because the mother of this poor boy thinks that it's the kid's fault. The option of buying a dermatome and a mesher does not exist if then the local population is not approached and educated the right way. This is an injury that in any other part of the planet would make the mother not the client, and would lose the responsibility for a number of things, including the care of their kids. And so certainly, let's say that the education at that point of the families, of the parents, of the adults, needs to be something that the ministry will have to work with.
Exactly. Yes, you are
And
right.
and at all level, so the community services from the hospital to the Ministry of Health will need to find a way to make the incidence of these injuries much lower. We cannot act just on the surgical side in purchasing more instruments and training more doctors. We need to train and educate the families. You are absolutely right.
I hope that the Ministry of Health will take it upon themselves to do something about it. To conclude this, we have had fantastic support from the senior members of the hospital and the junior staff as well. So I would certainly say that we have been very lucky to achieve what we wanted to.
Yes, 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 yes. Absolutely, absolutely. We did a lot of work for that.
Well, you did most of it.
Oh, thank you, thank you, thank you, thank you. Landing in Zanzibar on a Sunday at 7:30 in the morning, and starting the screening straight away at 10:30, to then start operating non-stop from Monday morning until Friday.
Yeah.
It was certainly a bit of a marathon, but by the end of it, it was all worth it.
But Dr. Kotrofo, that shows how committed you are, that you did not sleep well in the plane after 12 hours of journey. You just had a quick shower and you started working. And it's amazing. And
Thank you.
I take my hat off to you.
Thank you, thank you, thank you, thank you. I could not have done it without you.
Thank you.
The reason why I came to Zanzibar is because in here, unfortunately, the incidence of burns is extremely common. What we did is to bring over the instruments for skin grafting, because unfortunately here in Zanzibar there are still no instrument to manage burns. In order to complete this progression for the development of the burn unit here in Zanzibar, please help us with more donation with the link below. That is for the Health Smile Trust, which will keep supporting this mission.